Hi, I'm Virginia from the International Medical Writers Association, and here with me today is the lovely Dr. Claire Bacon, who's going to run us through a presentation in her area of expertise, which is editing research papers. Thank you so much, Claire, for being here today, and you are welcome to introduce yourself and start your presentation.
Thanks very much, Virginia. Happy to be here. I'm going to share my screen. What I'd like to talk to you about today, as Virginia mentioned, I work as a scientific and medical editor, and I edit primarily research papers written by scientists who are planning to submit these papers to journals for peer review. And what I wanted to talk to you, the medical writing community, about today was how to go about not particularly editing, but how to write these research papers. Okay, because I know many of us do that. And I want to focus particularly on writing a research paper using what is called the IMRaD model. Okay, so this is a, wait a second. Do you know how do I... This is something else we can cut out. Here we go. There we go. So why do we use this IMRaD model in research writing? The reason that we use this model is because it allows us to structure our research paper in a really clear and coherent way. So it is typically divided into 4 different sections. We have the introduction, the methods, the results, and the discussion sections. And these different sections each have specific jobs to do. So in the introduction section, we essentially tell our reader why we are doing this. Okay, why is this research topic interesting? Why are we bothering to put our effort into investigating this? And what we also do in the introduction is to tell our readers specifically what we are planning to investigate, so what our specific research question is. In the methods section, we talk about what we did. Okay, so we explain to the reader what is our strategy for answering the research question. In the results section, we tell the reader what we found. Okay, so there we talk about the data that we've gathered and how we can use that data to answer our research question. And finally, in the discussion, we bring it all together. Okay, we talk about what it all means. Okay, how do the results that we've gathered answer our research question, and how does that fit in to what we already know? Okay, so how does our data that we've gathered support that research question or the answer to the research question? And what about the published data? How does that fit in? And in the writing world, we often refer to this model as the hourglass model. And that is because, or linked a lot to how specific or how general the information we're presenting is in different parts of the manuscript. So you can see from the diagram here that in the introduction section, we start off very broad. Okay, here we're giving the reader the context. We're letting the reader know everything they need to know to understand the study in a broader sense. And then gradually, we start to narrow our focus down as we hone in on the specific knowledge gap or the specific problem that we want to address in this study. And there we also ask a very specific question. There again, that's where we're telling the reader exactly what we are investigating here. We then stay very specific as we talk to the reader about what we did. So how did we go about answering this research question and what we found? Okay, what data did we gather? Then in the discussion section, we start off fairly specific. We're talking about our specific findings, how they answer the research question that we asked, and then we gradually broaden out again as we start to discuss how this data fits into the field as a whole. What are the broader implications of these findings? And we typically will come full circle in this model. Because in the discussion, we will answer or address the problem that we introduced the reader to in the introduction. And in this way, these 4 sections are very tightly linked together. Okay, they form a nice, cohesive overall structure for our research story that our readers can follow and understand. Now, although we have 4 sections, it's pretty clear what each section is doing. What I find, based on my experience of an editor, is that lots of scientists really struggle to master this structure, to really use it effectively. And that is essentially the motivation for this webinar today, to give you a very clear strategy to write research papers using this structure. So how can we master IMRaD? I think one of the easiest ways is to have really clear templates for each section. Okay, so to have a very clear idea when you're writing an introduction section or a methods section or a results or discussion, what exactly do I need to put in? And what order should I present the information? What should I leave out? What are the common mistakes that I should avoid? Okay, so that is essentially what I'm going to be doing in the next few slides. I'm going to be giving you really clear templates for writing each section. What we can also do, though, and I wanted to mention that here, is to keep in mind how important our research question is for the overall cohesion of our manuscript. Because the research question that we ask towards the end of the introduction, that is the focal point for the whole paper. And by that I mean that the introduction section introduces that specific question. The method section explains how we're going about answering that question. The results gives us the information, the data that we need to answer the question. And finally, the discussion offers the answer, okay? And justifies that answer based on our data and what is published in the literature. So that is something that you can check, okay? When you've got your first draft, maybe after a few rounds of revising, you can think about, is my research question the focal point of my paper? Does my introduction introduce it? Does my method section explain how I'm going to go about answering it? Does the results section give me the data I need to answer it? And do I give an answer to that research question in the discussion? Okay, so I like to tell my students, bring them aware of how important that research question is for the focus of your study. But as I say, what I'd like to do in the next few slides is give you clear instructions on how to write each of those sections. Before I do, I want to remind you that you are submitting to a journal who has their own guidelines. And I just want to make you aware that anything I say today is trumped by what the journal wants you to do. Okay, so what I'm presenting today is, I think, really nice, clear guidelines on how to write a research paper, but journals may have their own specific requirements. Okay, they might have certain things they want you to address in the introduction, they might have certain things they want you to put into the methods and so on. So make sure you're clear on those guidelines and that you follow them. So the introduction, the first section of our research paper, I've put a little diagram here to remind you where we stand with regard to our hourglass model. Here we start off by giving the reader general context, okay? Giving the reader the information that they need to understand the study. And then gradually, we lead our reader towards our specific research question. Okay, how exactly do we do that? We start off by giving context. Okay, here's where we start off, giving the reader all the background information they need to understand the study. And what we should also try to do from the get-go is to hint at the problem area, to hint at why is this research area important? Okay, so if you're talking about a specific disease, you might talk about high mortality rates. You might talk about lack of treatment or lack of effective treatments. Okay, so you're already hinting at why this topic is worth our attention. Then we talk about the current knowledge. This is where we tell the reader what we know. So, what advances have we already made? What do we already know about the field? What is the status at the moment? And that sets us up really nicely for highlighting the gap in the knowledge that we want to address. Okay, so although we've made leaps and bounds over the years in this area, this is still a problem. This we still don't know how to address. This knowledge is still missing. Okay, and then after that, we tell our reader how we plan to address that problem or how we plan to fill that gap by telling them what our specific research question is. And I've put it in bold and underlined it just to remind you that that's very important. We then finish off by rounding up our main objective. So here we're essentially given a brief description in 3 or 4 sentences of how we plan to address that research question. What are our main objectives? What's our study setup? What you may also choose to do at the end of your introduction is to give the key findings. Okay, I've put that in brackets because that isn't a must. It is something that some fields do. So what I suggest that you do is you check the journal you're submitting to. Do papers typically end their introduction by summarizing the key findings, or do they particularly round up by summarizing the objectives and the study setup? Okay. Before I talk a little bit about what typically goes wrong in the introduction section, I wanted to talk a little bit about the opening sentence. Okay, because of course, here we've got an opportunity to really grab the reader's attention. Yeah, that opening sentence, we're all writers, we know how important it is. We want to convince the reader that it's worth carrying on, that it's worth reading further. So we need to give important information. And it can be tricky because, as you know, we're starting off by giving the broader context. It can be very easy to fall into the trap of giving a very generic, dull statement that might turn the reader off. But there are ways that we can give general information while still emphasizing the importance of that information. And I have some suggestions for ways that you can do that. So yeah, you can make a general statement of something that is widely accepted, but you can emphasize at the same time the importance of that. Yeah, so I have here an example, something like regular exercise is essential for enhancing both physical and mental well-being. That is a very well-established statement. You probably don't need a citation for that. I think we all agree that is true. But it's got the reader's attention. Oh, we're talking about something that really matters here, something that's important. Okay? We can also open with a statement that stresses the importance of the particular topic. You know, so if we're talking about malaria in a patient population from Ethiopia, where outbreaks are sadly quite common, we can say something like, you know, malaria outbreaks in Ethiopia are fatal to many people because medical facilities are not immediately available. Okay, so that tells the reader, hey, this topic matters. You know, it's worth paying attention to. We might also choose, if we're working on a particular hot topic, to highlight how much interest our topic is currently generating. So I'm sorry to take you back a few years to the start of the pandemic, but there, of course, we were all really obsessed with finding, or when will we have a vaccine? When will we have our way out of this mess that we're in? So there, you can really play on that interest. You can say something like, you know, since the onset of the COVID-19 pandemic, researchers worldwide have been scrambling to develop an effective vaccine. Okay, so you can really emphasize that this is currently generating a lot of attention. What typically goes wrong in the introduction? So obviously over the years I've edited thousands of research papers, and these are some of the common traps that writers fall into. The first one is not thinking about the reader. Okay, so I've talked about how we start off by giving the general context. But you need to think about who you're writing for. Okay, where are you submitting your paper? Are you submitting to a fairly broad journal with a very broad readership? Or are you submitting to a more niche journal that has a more expert readership? Because that's going to dictate where you pitch your information, where you pitch, at what level you pitch that context. Okay, so if you're writing for a general audience, you don't want to start too specific. They're going to need that broad general background information to ease them in. Whereas if you're writing for a more expert audience, they're likely to be pretty bored if they have to wade through 2 or 3 sentences that are rather stating the obvious. Okay, so that's something I'd like you to think about. Who am I writing for? What do they already know? Where should I start? Another common mistake is putting in information that isn't relevant. And by not relevant, I'm not saying that it's not interesting or that it's not kind of relevant to the topic. I'm talking about information that is not leading the reader to the specific research question. Yeah, so look at my little diagram there. That is the whole point of this section. We are slowly bringing our reader from the general background towards the specific research question. That is the path we should be taking. And if we add information that isn't directly relevant to that specific research question, we're taking our reader off on another path. Okay? And we have to remember that while we, as the writer, we have a clear idea where the story's going, our reader doesn't. Okay? They're not going to be aware that this information has little to do with what the study's actually about, and they're going to waste energy and attention wondering, how does this fit in? Okay, so this isn't something I want you to worry too much about when you're drafting your paper, when you're getting your ideas down, but certainly when you come to revise your draft. Scrutinize every sentence in your introduction and ask yourself, is this directly relevant to my specific research question? And if it isn't, then it needs to go. Okay? This is perhaps the most serious mistake that we can make in the introduction, and that is that we have a research question that's too vague. So I want to talk a little bit more about that because I think by now I've made it clear that the research question is important. I've talked already about how it is the central focus of the study. And the problem that we have, that if the research question is beyond the scope of the data that we're presenting, then we are not going to have a credible paper. Okay? Our research question, it needs to address the knowledge gap that we've talked about, and it needs to be specific. It needs to have specific outcomes, and it needs to be within the scope of the study. So what I mean by that, when I talk about the research question being within the scope of the study, I mean that the study is able to answer it. Yeah, that the data that we present in the study can answer that question. Okay, and I think you can appreciate that if we have a very vague research question, that it's going to be a lot harder for our data to answer that question. Okay, so I have a couple of examples here of two versions of the same research question, just to show you what I mean by that. So this, in my opinion, would be a specific research question. How does anti-PD-1 affect 1-year overall survival in patients with non-small cell lung cancer treated in our institution? Okay, we have a specific treatment. We have a specific outcome. We're looking at 1-year overall survival. We have a specific patient population, and we're mentioning a specific subtype of lung cancer. Okay, so that is specific. There is a very good chance that we can gather enough data to answer that specific research question. Compare that with another version of the same research question. Does anti-PD-1 reduce mortality in patients with lung cancer? Okay, I think you can see that that's considerably more vague. Yes, we have the same specific treatment, but what do we mean by mortality? Okay, 1 year, 2 year? Are we talking about overall survival, disease-free survival? What do we mean by that? And lung cancer, okay? That's fairly broad. And you can see that there is no way that one study could gather enough data on all types of mortality, on all types of lung cancer, in all patients worldwide. Okay, so this is what I mean when I say that the research question is too vague. We need to be very specific about who we're studying, what we're studying, and what our specific outcomes are. Moving on to the methods section, the whole point of this section is to give the reader enough methodological information, okay, to fully understand exactly what you did. And that's important, okay? The reader needs to know exactly what you did, for example, to judge the credibility of your findings. Okay, so they're going to see your data, and to be able to judge for themselves how credible those findings are, they need to understand how you gathered that data. At the same time, they might want to check the reliability of your findings by repeating your work. Can I get the same results if I do the same experiments? They need to know exactly what you did to be able to repeat the experiments. And they may want to compare your data with their own data. Okay, maybe you're reporting on a certain patient population, they have data on a similar patient population, they'd like to compare the data. They can only really do that if they know how you gathered the data, if they know that the approach to gathering the data is aligned with theirs. It's not on the list there, but another important point is that you make your data accessible to other researchers to use in systematic reviews. Okay, so they need to know how you gathered your data so that they know whether or not they can include your findings in their systematic review. Okay, so the details are important. Now, I think you can appreciate that the methods section, there is no one-size-fits-all template here. It's going to develop very much on your study type, your particular research story, how this should be structured. But I wanted to just bring your attention to the guidelines from our style guides, what they say about how you should structure the method. So if you are looking for a helpful checklist, I think that these are really useful resources. So the current version of the AMA style guide, you can find this information in section 2.8. They ask us to talk about the study design, the study type. They ask us to give details of study dates and study follow-up. They also ask us for information on ethical approval. Of course, we're medical writers. We're often reporting on clinical data involving human patients. Very often we need ethical approval for that. And, AMA want to see that we have got that approval. We need to talk about what we studied, okay? What particular condition, what particular factors, what particular disease, for example, and of course, who we study. So our sample details. What exactly or who exactly was the study population? What was the study setting? How did we recruit our participants? What inclusion and exclusion criteria did we apply? We should talk about any interventions or exposures and what we measured. So what were our specific primary and secondary outcome measures, or what observations did we make? And typically we finish by a clear description of how we analyzed our data. Okay, I've edited very few papers that haven't ended with the statistical analysis, and it is a nice ending to the methods because it offers a nice transition to the results that are going to follow. Okay, so ending with the statistics is very common. I also wanted to make you aware of the reporting guidelines for the different study types. So you can go to the Equator Network website, and there you will find detailed guidelines on many different study types that will give you, in many cases, a very detailed checklist. So the text's kind of small. You don't have to read this right now. I just wanted to bring your attention to the level of detail that you can get from these guidelines. So this is the PRISMA checklist for the methods section. So the PRISMA guidelines, these are guidelines on how to write a systematic review. And you can see here that you have many different criteria that they want you to include and specific descriptions of what they want you to talk about. Okay, so if you are struggling, what do I need to put in my methods section? You can use the AMA style guide for a general guide. You can look to the specific reporting guidelines for more specific details. Okay, the resources are there. What common mistakes do authors make in the methods section? Talked a lot about the importance of detail, and I think perhaps the most common mistake is leaving out important information. Okay, so use those resources, use those checklists, make sure that you've included everything that your reader needs to know to understand your approach. You might include the information, but you might not divide it into logical subsections. The problem there is that the information is just not accessible to your reader. So think of how you read a research paper. I think very few of us, settle down with our tea and decide to read the methods section from the start to the end. This very rarely happens. We're looking for specific information. We have a specific experiment that we're interested in. We want to know how the data was analyzed. We're looking for something very specific. And we're only going to be able to access that information quickly and easily if we have nice logical subsections with nice, clear, and informative subheadings. Okay, so do make your information accessible to your reader. Another common mistake is presenting results. An easy trap to fall into because you talk about what you did. It can be very easy to then mention what you found. But remember that you have a specific section for saying what you did. You have another specific section for saying what you found. That is where your reader is going to be expecting to find that information. Okay, so make sure that you put results in the results section and not in your methods. An exception can, of course, be made for any results that you use to develop your methodology. So if you've conducted a pilot study, for example, where you wanted to figure out exactly how you were going to design your actual study, that kind of data that is directly related to developing the methods, that can be included. And my final mistake is self-plagiarism. Seems kind of contradictory. How can you plagiarize yourself? It is not okay, I'm sorry to say, to copy text from the methods of a published paper and paste it in your latest paper. Simply because the copyright is no longer owned by yourself, it's owned by the publisher. But what you can do, of course, is to refer your reader to that publication with a proper citation. Okay, so you can perhaps have a couple of sentences briefly saying what you did and refer your reader to your earlier publication for the details. Okay, so proper citation practices there. Moving on to the results section. So this is where we tell the reader what we found. And here we want to present our data in a very clear, very logical, and also objective way. Okay, so we're telling the reader what we found without interpreting what we found. Okay, and we do that typically by having paragraphs of narrative text where we guide our reader through our experiments and talk about what we found. And we also have figures and tables that supplement our narrative text. Okay, and these are extremely useful, not only to you as a writer, but to your reader. First of all, they give the reader a welcome break from the blocks of text. And figures and tables, they're a great way to present lots of information in a way that is clear and accessible. Okay, so we can use figures, graphs to show relationships, to show trends, to show patterns among the data. We can also have diagrams, so flow diagrams, for example, showing how patients were recruited, excluded in the study. And tables, we can have maybe several patient groups with many, many different variables. In a table, the reader can quite easily find information, can compare variables between groups. And I think that you appreciate that this information that we're presenting in figures and tables in this way, we just couldn't present it as effectively in written paragraphs. Okay, so figures and tables obviously play a really important role in the results section. How should we structure the results section? Rather like the methods, there is no one-size-fits-all template. It's going to depend a lot on your particular research story and, of course, your study design. But the first thing you need to do is to decide for yourself in what order you want to present your results. Okay? What makes the most sense? For example, you might follow the order of the experiments that you already presented in the methods section. Okay, so the first experiment in the methods, those are the results you present first in the results, and so on. And that, if it works for your paper, that's very, very effective because it also creates a really nice consistency between the methods and the results section. It's not always fitting, though, and what you need to do when you're thinking about what is the best logical order for you is to think carefully about your research question, your main conclusions. Yeah, because that is going to help you come up with the best logical order for your results. I also want to talk about, on the topic of structuring the results, the importance of paragraphs. So paragraphs are important in all your writing, of course they are, but they are particularly useful in the results. Okay, so remember here we're talking about lots of values, lots of statistics, lots of associated statistics, lots of relationships between variables. And this is the kind of information that is really hard to follow if it's not presented clearly. Here, paragraphs are your friend. So make sure your paragraphs are clear. Make sure you deal with one finding per paragraph. Yeah, we all know one topic, one paragraph. In the results section, try to stick to one finding per paragraph and use effective topic sentences. And by that, I mean say in your topic sentence what the finding is. What is the main finding? Okay, the main trend, the main relationship, and then go on and develop your paragraph by presenting the details that back that up. Okay, that is far more effective than starting out with all the details, with all the values, with all the statistics, with all the associated statistics, and then ending with the main finding. Because there the reader is trying desperately to figure out what it all means. If you tell them up front, this is the main finding, and then present the details that justify that statement, that is much easier for the reader to digest. Okay, so clear paragraphs, effective topic sentences in your results section, please. Again, I wanted to bring your attention to the reporting guidelines. These also offer us a nice checklist, sometimes even a nice logical order in which we can present our results. Okay, so here I have, again, the Prisma checklist, this time for the results section. Okay, so make use of those resources. Before I chat to you about common mistakes, I wanted to give you some tips for tables and figures. So I've talked to you already about how much tables and figures can enhance the results section, how helpful they can be for the reader and for you as a writer. So I have a few tips here on how you can get the most out of your tables and figures. My first tip is to limit the content that you present to essential information. Okay, please don't see particularly your tables as a dumping ground for information. Okay, I don't really know what to do with this. I'll put it in table 1. Think carefully about what is the main message of this table. What do I want my reader to get out of it? And put essential information only. I've talked a lot about how tables and figures help the reader to get information quickly and easily, but only if we make them readable. Okay, so don't crowd your tables, don't crowd your figures, because they will lose their power. They will just create, instead of being a welcome help to your reader, they're just going to be another headache. Okay, so keep the information limited to essential information only. Use the title. Yeah, the title of the tables and figures can be really informative. Okay, so make sure that the title clearly describes what that table or figure shows. Okay, try not to put too much background information in there, and try also not to interpret the results. Okay, tell your reader what it shows and let them draw their conclusions. Okay? Tables. So this is something I often see, that authors will, for example, divide their patients into 4 subgroups, and then they write this in their table, group 1, group 2, group 3. And I often think that, is that really informative? Because now the reader has a job to do. Oh, what was group 1 again? Let me go and check. Yeah, it's much better to, in the table, if possible, tell your reader what the group was. Okay, so I say here, if you've divided your patients into a laparoscopic and an open surgery group, then putting those words in the column heading is much more helpful than saying group 1 and group 2. Okay. Now some obvious statements that you as medical writers, it might seem very obvious that the data is accurate and it corresponds to the narrative text, but believe me, it happens so often that they are not. Okay, that the data are not accurate, particularly with percentages, or that the values that we present in tables and figures don't correspond to what we say in the text. And I can see where these errors arise, that we'll modify a figure, we'll modify an analysis, and we'll forget to adapt the text accordingly. So that's something to be aware of. Make sure that your data are accurate and that they correspond to what you have put into the text. Defining all symbols and abbreviations in the legend, again, obvious, but often not done. Also worth remembering that abbreviations should be defined in your table legend, in your figure legend, even if you have defined them in the manuscript. Okay, most journals want tables and figures to stand alone without reference to the text. So if you're using an abbreviation, make sure you define it again in the legend. And things like bold and italics, please only use that where it's really helpful. Yeah, not just to look a little bit better, look a little bit more interesting. Make sure it has a specific function. And tell your reader what that function is in the legend. Okay, so I often see that people use bold italics to draw attention to p-values that are significant. That is a legitimate use of bold text, but you also need to tell the reader why you've highlighted them in bold in your legend. Okay? So, yeah, and finally, referring to them in the narrative text. So the figures and the tables, they are an important part of your story. Okay? It is really important that you explain in the text how that figure, how that table fits into the story. Okay, it can be incredibly distracting to the reader to see a figure that isn't mentioned, because they have a job to do. They have to figure out for themselves how that fits into the research story. Okay, so make sure that all your tables and figures are referred to. And that is also applicable to any supplementary information. It all needs to be mentioned in the text. common problems in the results section, things that I often see in research papers that I edit, is interpretation. Okay, remember we're objectively presenting data, so look out for any phrases like suggesting that, showing that, indicating that. Yeah, here your job is to say what the data was, and then later on in the results, you can tell the reader what it means. I've already talked about how important it is to have a nice logical order to the information, nice logical subsections with headings. Again, and I think I made this point with the methods, make sure you have those. Yeah, I think one of the most common mistakes is that we have just this block of continuous text. Again, your reader isn't very likely to read your results section from beginning to end. They're going to be looking for specific information. So make sure that that information is easy to find. Vague statements that add no value to the narrative. So things like saying that there were differences between the groups. Okay, can we say what differences? Yeah, and which variables are we talking about? Was it higher? Was it lower? Faster, slower? In which group was it highest? Which group was it lowest? Be specific, okay, about your data. And also presenting values without stating the relationship. I see this as well. So I have an example here. You might write that the mean resting blood pressure was 85 milligrams of mercury in controls and 94 milligrams of mercury in football players. And of course, everybody knows that 94 is higher than 85, but your reader has a job to do here. They have to spend a second or two figuring out what that means. Compare if we say that the mean resting blood pressure was higher in the football players than in control participants with the data in brackets. So that's much easier. That just reduces the cognitive load on the reader if we tell them what the relationship is. Okay, so we'll move on now to the final section of the research paper in the IMRaD model. That is the discussion section. You'll remember here that we have the inverse situation to the introduction, in that we start out with our very specific findings, the answer to our specific research question, and then we gradually broaden out as we discuss the broader implications our work has on the field. So, how should we structure our discussion? We should always start by, I say, repeat and answer the research question. So, remind your reader what your study's about by telling them again what your research question was or what your study aims were. And then answer that research question. Okay? So, in this study, we set out to look at ABC. We found that. Okay, you give the question, you give the answer. You then, in the next paragraphs, you defend that answer. Okay, this is what we think, and this is how our specific data back that up. Okay, you also draw on the published findings to support your answer. That is one point. That is obviously may take multiple paragraphs to do. You have to explain any unexpected findings, okay, and any discrepancies there were between your findings and those of other studies, okay? Don't shy away from this stuff. Don't shy away from unexpected findings. Don't ignore discrepancies with other studies. Tackle them, acknowledge them. Okay, they are to be expected. There is nothing wrong with unexpected findings. In fact, if there are no unexpected findings, it looks a little suspicious, I think, because that is the nature of research. Discrepancies with other studies, again, there are many good explanations why that might be the case. So don't ignore these points. Acknowledge them, discuss them in your discussion. Towards the end, you need to take the time to discuss the strengths of your study and also the limitations, okay? And finally, almost finally, to emphasize how your work has solved the problem or the gap in the knowledge that you outlined in the introduction. and we end by discussing the broader implications of our work. Okay, so here we're talking about how, our work has solved the problem that we were talking about at the beginning. It's highly unlikely that you've completely solved the problem. More realistically, you've taken a few valuable steps forward. Here towards the end, then, you can emphasize what still needs to be done. What should future studies work on? Yeah, what existing steps are still needed towards the solution? What are the broader implications of your work? And here's your chance to really end on a bang, really promote how your results have advanced your field. Common mistakes. Perhaps the most common is repetition of introductory information. So I think in more than half of the papers that I edit, I get to the discussion section and I am looking at half a page to a page of repetition from the introduction. And I understand that because, we get to the discussion, how we're going to talk about how we're interpreting our results, what we think it all means. Oh, I better remind the reader what I'm talking about. So we start justifying the rationale, we start giving background information, and so on. It's not necessary. Okay, we have a section called the introduction. That is where the reader is expecting to find information on the background of your study. Here in the discussion, they want to know what it means. Okay, and remember that I talked about at the opening of your discussion, repeating your study aim, repeating your research question. That gives your reader enough of a reminder, okay, what the study is about. There's no need to go back to the beginning and start repeating introductory information. Not giving the answer to the research question at the start. So you remember in my template, not only do we repeat the research question, we give the answer. And, I think some writers, they're a bit reluctant here because they think, well, that's the big reveal. Surely I should wait till the end and tell the reader the main finding at the end. I need to keep them in suspense. But this is not a murder mystery novel we're writing here, where we are revealing the murderer at the very end. What is the purpose of our discussion? Yeah, we want to answer our research question, and then we have to justify that answer. We have to prove that answer is sound by referring to our data and referring to what is already published in the literature. Okay, we can't do that. We can't justify our research, the answer to our research question, if we don't first tell the reader what it is. Okay, so make sure in that opening paragraph that you give your answer to the research question. Another common problem is excessive repetition of the results. So obviously the purpose of the discussion is to discuss our results. Of course, we need to refer to those results in order to be able to discuss them. But I'm talking about, as I say, excessive repetition. Okay, you need to be giving a brief reminder of the main trend. Yeah, we do not need to be giving specific results. We certainly don't need to be referring back to tables and figures and giving specific values. Okay, so make sure that you just briefly summarize the main finding that you're discussing without going into too much detail. Again, we have a whole section for that. We have a whole section where we describe the results in detail. That is where the reader is expecting to find that information. Here in the discussion, they're expecting to find out what it all means. Okay, so try not to over-repeat your results. Another common problem is focusing too much on published data and not enough on your own findings. So obviously the whole point of the discussion is you're justifying the answer to your research question with your data and with the data from published studies. But what I sometimes see are perhaps 2, 3, 4 paragraphs where the writer is discussing the literature and in no way referring that to something that they have found. So it's like a bit like a literature review. You need to remember in the discussion that your job is not to summarize the literature. Your job is to tell the reader how the literature relates to what you have found in this study. Okay, so try to make each paragraph in your results section, try to make the focus something you have found. Okay, and not have a paragraph or 2 paragraphs or more on things that other people have found. It's fine to refer to other studies in considerable detail, indeed you should, but always relate it back to your findings. Okay, that is what your job is in the discussion section. And not acknowledging the limitations. This is another mistake and very understandable, particularly among my younger students. I see that they're very reluctant to do this. It's almost like they're scared to draw people's attention to the limitations of their work. And they feel that, by emphasizing, excuse me, what is a limitation, I'm kind of undermining the credibility of my work. But that's not true. The opposite is true. By acknowledging openly the limitations of your study, you actually increase the credibility. Okay? Your reader, which includes your peer reviewer, are going to be aware of these limitations. They are likely to notice them as well. And what they're going to want to see is that you have kept them in mind when you drew your conclusions. Okay, so if you spend a paragraph acknowledging your limitations and even defending them, you can do that too. You show the reader that you have, first of all, you're aware of these limitations and that you have considered them when you drew your conclusions. Okay? It's also perfectly fine for a study to have limitations. Every study does. Okay? There's nothing to be ashamed of in acknowledging that there are limitations to your study. Okay, so acknowledge the limitations. That enhances, it does not diminish credibility. That being said, another, common, not as common as ignoring the limitations, but another common problem is undermining your conclusions. Contradicting myself here, aren't I? But I'm going to show you a couple of examples to show you what I mean by this and how you can avoid it. So it can help sometimes to acknowledge the limitation up front and then end with the significance of your findings. It's a little more powerful. So let me show you an example of what I mean. Here we say, our findings show that this intervention can improve patient prognosis, but the small sample size limits the generalizability of these findings. So here we've talked about something that our results show, something really positive, and quite rightly, we've also acknowledged the limitation. Yeah, that's credible, that's good reporting. But we can make things, put a more positive spin on things if we just reorder the information, if we start off by acknowledging the limitation. Although the sample size limits generalizability, our findings show that this intervention can improve patient prognosis. Okay? Just a little trick for emphasizing the positive while acknowledging the negative. So those are the 4 sections of the research paper. Also, an important part of the paper that comes at the very beginning is the abstract. Okay, that is where we summarize the whole story. Okay, the whole research story in a paragraph or 2 at the very beginning. And I write there that this is arguably the most important part of the paper. So I often refer to it as the home page for your manuscript. Okay, that's where most of your readers will land, first of all. That's what most of your readers are going to look at, first of all. And then they're going to decide, based on that, whether or not to read the whole paper. So we need to put effort into this. We need to make sure that it's effective, that it's good. There's often quite a strict word count on the abstract. I was looking at typically 300 words in a range from about 250 to 400. And in these 300 or so words, we have to include all of the following. We need to give the essential background information and the rationale. Why is this study important? We need to make sure the reader knows the specific problem we're addressing or knowledge gap and what our specific research question is. We need to give the main methods and results, and we need to give our conclusions. Okay, we need to answer the research question. We need to discuss the implications. That's rather a lot for 300 words, but it is feasible. And it is important to be aware that if any of these elements are missing, that the abstract will be weak. Okay, indeed, that's my first common mistake, that we do not include all 4 elements. It's linked very much to this problem of focusing too much on one element at the expense of another. So I will see an abstract where the reader essentially summarizes their main findings. That's great, because as a reader, we're very well informed about what the study shows, but we have no context. We don't understand why those results are important to the field. Neither do we know what they've brought to the field. We have no conclusion. The abstract's weak. We might have an awful lot of context, an awful lot of background information, so we're really, we see why this work is really important, and then it kind of falls a little flat because we don't have much data and we don't have any conclusions. So, we understand, yes, this is important, but we don't see what the outcome was. Okay, so it's important that we have all 4 elements and that we give them more or less equal attention. Adding references to the abstract, most journals will ask you not to do this. Similarly, abbreviations should be avoided. Okay, and particularly those first two problems, we can avoid them by doing a structural analysis of our abstract. Okay, and this is something that I do with my students. I ask them to do a little color code experiment. Okay, so they look at their abstract, they decide whether it's background information and rationale, they highlight it blue, whether it's the problem or the gap or the research question, they highlight it in green, methods and results, we highlight in red, and any conclusions and implications, we highlight in yellow. And then we can see, no need to read this abstract through just yet, you can at your leisure. This I just wanted to show you how this works in theory. We analyze each sentence and we come up with this. And you can immediately see that you have rationale, gap, methods and results and conclusion. They're all there. We can also see straight away that we've got considerably more methods and results than we have rationale. In this case, that is fine, okay, because the rationale of this study is fairly well known. There's no need to go into a lot of detail. What is most important here are the methods and the results. So it's okay that we have slightly more attention placed on the methods, because we can see that it's not at the expense of the other elements. We have rationale, we have the research gap, we have the research question, we have methods, we have results, and we have a conclusion. Okay, so that is a good way to check that your abstract is structurally sound. I want to close it up today by talking a little bit about how to get started. So we've talked a lot today about exactly how we should structure each of the sections. We've talked a lot about what we should avoid, what we should include, but how do we get started? Yeah, even with this really clear idea of what goes in each section, what do we do at the beginning where we are faced with masses of data and our job is to write a research paper? Okay. You might think, okay, so the first section is the introduction, I start there. That is definitely not the best place to start. And I'm going to give you now a strategy that I use. It's not the absolute only strategy. Others might give you different ideas, but almost everyone will tell you not to start with the introduction and not to start with the abstract, although they come first. So how do you get started? How do you break that feeling of being really overwhelmed and that writer's block? You should start by creating what I call a storyline for your paper. And this is where you jot down the key points, your key take-home messages, and they are your motive, so the rationale, why is this study important, the research question, what exactly am I looking at, the main methods and results, so not an exhaustive list of everything you did and everything you found, the main approaches, the main findings, and your main conclusions. Okay? Because then you have these clear take-home messages. They're clear in your head. And that will help you to keep those in mind while you're writing. Okay? So you've got your storyline. You've got a clear idea of your key take-home messages. The next thing to do is to start writing. And start with what you know. Okay? Typically, the easiest sections to write are your methods and your results because they are clear. Okay? Your methods are your methods, your results are your results. There's less thinking to do about what should go in. So it's better to start with those sections. I typically encourage my writers to start with the methods because they are typically the easiest. The order is usually clearer and it kind of warms you up. Yeah, it gets your writing muscles warmed up. And then the results. Okay, you've got your methods drafted, you've got a fairly clear chronology in your head of your study, and you can draft your results. Better to start by drafting your tables and your figures, and then to start working on what those tables and figures show and developing your narrative text. Once you've got your results, you have a clear idea of what you want to show your reader. And that will give you a clear idea of what your reader needs to know to understand those results, in which case you're in a good position to draft your introduction. And do use the template I gave you, okay, to do that. If you follow the template, you'll have a nice, well-structured draft. After that, you can draft your discussion, again, using the template I gave you. Once all that is down, you're in a good position to draft your abstract by writing a few sentences on each of the 4 elements that I presented to you. And there you have your draft. Okay? After that comes revising and editing. That is a topic for another webinar, I think. I would like to end there by thanking you very much for your attention and by letting you know that if you have any questions, I welcome questions from anyone on any topic. Please do feel free to post any questions in the comments and get in touch if you like. I have my email address there. I'd be more than happy to answer any questions that you have. Thanks so much for your attention.
Thank you so much, Claire. That was a really insightful and helpful presentation on how to write a research paper using the IMRaD method. So I learned a lot, and I hope the audience really enjoyed this presentation and learned a lot too. So if you'd like to learn more from Claire, then please check out the links below. I'll leave them in the video description. And if you'd like to support more webinars like this in future, then please consider joining the International Medical Writers Association community. Thank you so much for watching, and thank you again, Claire.
Thank you very much.
All right, we will see you in the next webinar. Have a lovely day. Bye.